Welcome back to another episode of Visions for Health. I'm Wendie Trubow, and my guest today is Eric Roseen, Doctor of Chiropractic.
Hi, Wendy. Thanks for having me.
Welcome back.
It's good to be here.
So today we're going to talk about back pain, right?
Yep.
Tell me, first off, where'd you go to chiropractic school?
So I went to school in Portland, Oregon at the University of Western States, which is a chiropractic college and massage and a few other things.
Okay. And then somehow you wound up in Boston, and I recently heard you're doing a very cool fellowship. Can you tell me about that?
Sure. Yeah, so I moved out to Massachusetts to do an internship at Jordan Hospital in Plymouth, Massachusetts, which is now BI Plymouth. They have a primary spine care center. So people with acute back pain coming in are rerouted from the hospital, from the primary care offices to this spine center. So I moved out for a really great opportunity to learn about how to manage back pain, which is a really common condition. About a year ago, I started a fellowship through the National Institutes of Health at Boston Medical Center and BU School of Medicine in the Family Medicine Department.
Okay.
And I'm a research fellow, and I'm involved with a few of the studies that they have looking at yoga, massage, and a number of other integrative therapies for back pain and other conditions.
Were you interested in back pain when you went to chiropractic school?
I was. As in high school, I had a couple injuries as a wrestler, and so I had some back pain and some neck pain.
Yep.
And my coach made me go see the chiropractor. I had never been to a chiropractor, didn't really know what they did. But for me, it was really effective. So that's kind of what got me interested in becoming a chiropractor. And then as a chiropractic student and in practice, it's the most common condition that I treat: back pain, neck pain, and headache, which can relate to the spine as well.
How common is back pain? Are there stats?
Yeah, it's very common. It's one of the top 5 things that presents to primary care doctors' offices. It's the most common condition that presents to an integrative medicine office. 80 to 90% of people in the U.S. can expect to have an episode of back pain within their lifespan. So it's incredibly common, and it's the #1 cause of global morbidity, so the most common cause of disability in the world.
Seriously?
Seriously.
This is an expensive problem.
Very expensive. The direct costs are $86 billion, and the indirect costs, so if you miss work or you're not as productive at work, are $635 billion. Billion. So if you
in the United States or worldwide?
In the United States.
That's only here.
That's only here.
These numbers are staggering.
It's staggering. So the indirect costs can cover a lot of different things, and they're probably 5 to 6 times the direct costs, so what you actually pay for your health care.
So I'm not going to ask you how someone would know if they have back pain. That's probably pretty self-evident.
Yeah, sure.
Are there different types of back pain? So is it like chronic and acute, lower, upper? Like how do you characterize it?
It's a great question, and that's my research interest, because back pain is often thought of as this homogeneous group. Everyone's the same, but that's not true. But it can also be really tricky in separating people out. You can in theory separate people out by what you think is the cause of their pain. And in a small percentage of people, less than 10, it's something that is serious and very specific. But for the other 90%, it's maybe a joint, a tendon, a ligament, a muscle, fascia, a nerve. There's many other structures that can generate pain, so it can be very confusing to find one thing.
So is there usually a source? Like someone will say, I was doing X and Y happened and now I have pain. Or is it, I woke up and I had pain? What happens?
Maybe, and both. Some people have a very clear injury, and that's if someone kind of fell or were in a car accident. It's a little easier to know that their back pain came from that. But people can be bending over or trying to pick up something very light, like a folder or a paper clip, and their back can suddenly go into spasm, start to cause them pain, significant disability? And was it really them reaching over to grab that paper clip, or have they become stiff or weak over time? It's hard to tease out, but probably the latter.
So what do you do with someone who has back pain? I know that's a huge question.
Right. So the first thing that you do is you try to rule out that 10%, something that's very serious.
What are those things?
That's like cancer or infection, stenosis, radiculopathy, and some of those things are more serious than the others. Stenosis and a disc herniation can be managed conservatively, but you want to rule out the things that are a little more specific and serious. That gives you the rest of people, 90% of people who have something that could be multiple structures, multiple pain sources. So then you try to differentiate the patient and find out if it's more likely to be a muscle is causing their pain, if it's more likely to be weakness or stiffness, and what the best treatment is going to be for them, how you're going to approach it.
So once you've identified what the source is, or what if it's weakness, stiffness, muscular, ligament, what do you do with it? Like how do you stratify people? You go here, and what are those different things?
Right. So if it's someone with acute pain versus chronic pain, people with acute pain probably will do well with a number of things, and they'll probably need less care. So people with chronic pain is probably is more difficult to treat, so they might need more care. So you can kind of stratify by how much care this person might need. And then there are characteristics that someone might do better with spinal manipulation. So if someone has acute pain and it's not radiating down their leg past their knee, if they've had it for less than 14 days, there's a really high likelihood that they'll do incredibly well with treatment. And there are other systems to say that they might do better with exercise therapy. And there's a lot of research that needs to be done to kind of tease out who might do better with another therapy, something like acupuncture or yoga or Tai Chi. There might be specific characteristics that identify a person who will do well with those therapies.
So when you've adjusted someone, is it only bones, or are you doing muscular work too? So
when I'm treating someone, it takes 15, 20 minutes or so, and I'm spending most of my time working on the soft tissues, the muscles, the tendons, the fascia, because I find that a lot of structures are tight in spasm. They might have a knot or what's called a trigger point. So I spend a lot of time kind of working on the soft tissues to try to get them stronger, more limber, more flexible. And then I also look at the joints, and spinal manipulation or spinal mobilization or an adjustment is what I apply for that. And that can be done relatively quickly. So it's a smaller portion of the treatment.
And do you give people exercises to say, okay, you were tight here, so here's the exercise that will keep that area loose?
Yeah, for me, self-care is the most important thing and probably the most sustainable thing for a patient. I try to give specific exercises, specific stretches for someone with back pain or neck pain that they can do for the rest of their lives. Even manage future episodes, because these conditions commonly recur and they might be able to self-manage themselves. I also commonly recommend general exercise. Walking is one of the best things you can do for your back pain. Something like yoga, which we study at Boston Medical Center, has a number of studies that say it's good for chronic low back pain. So I'll often recommend yoga. And one interesting thing about yoga is that we did a dosage study at BMC that looked at if you do yoga once a week versus twice a week, is there a big difference? If you do it twice a week, is that's what's needed to see a big effect?
Twice as good.
Twice as better is twice as good as one. But that's not what we found. We found that if you did it once a week, you got a lot of the benefits. You had better function, your pain went down. And if you did it twice a week, maybe you got a small amount of additional benefits. And I think that study is really encouraging, because that seems attainable to a lot of patients, that they can do once a week and know that that's going to be helpful for them, for their general health, and for their back.
That's quite funny that you say that, because often if my patient's saying they're doing yoga once a week, I'm like, you got to do it more. But for back pain, that may not be the case.
It's a little counterintuitive, and there may be benefits over time of doing it more frequently. But for the things that are most important to back pain patients, their pain and their disability, it's once a week is going to help.
What are some other, how does acupuncture help with back pain?
So acupuncture is one thing that I'm not completely familiar with all the mechanisms, but there are mechanisms that are in the central and peripheral nervous system. There are local mechanisms that drive pain relief and may help someone return to function after a treatment. There's a number of studies that support use of acupuncture and guidelines for chronic low back pain, support the use of acupuncture. There's not as much support for acupuncture for acute low back pain, but for chronic low back pain, it seems to be some support for that.
Can I ask you a question that might be a little bit incendiary?
Sure.
Is there a component of an emotional component to pain that makes a difference per people? So do people who have high anxiety or depression experience pain in a greater fashion than people who don't? Have you found any of that?
Absolutely.
Okay.
To really treat low back pain effectively, you have to think through a biopsychosocial approach. So we've talked a lot today about kind of the structures that cause pain, but the psychosocial piece, the person's community and job and circumstance, are they stressed, do they have depression or anxiety, that's all going to influence their back pain and the ways they cope with their back pain. So one example is something called fear avoidance beliefs, which I see all the time. Someone has low back pain and it can be intense, it can be scary, and they may stop moving. In some ways that's intuitive. If you have a lot of pain and you move and you feel that pain, you might want to stop moving. But that pain, the hurt, doesn't equate to harm. You're not doing more damage when you feel that pain.
Right.
But if you don't know that and you think you're doing more damage by moving, you might stop moving, and when you stop moving, things get stiffer over time, things get weaker over time, and you're actually more likely to develop chronic low back pain from an acute episode.
So what about someone who has high anxiety and has pain? How are you working with them to, do you send them to mindfulness programs? And how do you even address that? Like, I see you have high anxiety. You can't say that, right? Or maybe you
right.
can.
So I do a questionnaire that measures the effect of back pain on their pain, on their function, activities of daily living, that captures if they have high anxiety or high depression. And if they do, then something like yoga might be good, because that's a biopsychosocial self-care strategy. It's a mind-body practice as well as an exercise therapy. Certainly MBSR is something that would be good if someone's interested in that. There are breathing techniques and meditation techniques that can be quickly taught or learned on one's own that might also be helpful.
So do you know, and I didn't prep you for this, so if you don't know, it's okay.
Yeah.
Do you know if there's data that supports mindfulness-based stress reduction programs in yoga and decreasing anxiety as decreasing pain?
So for yoga studies, they don't. Ask your question one more time.
Are there studies that show that actually decreasing anxiety will decrease pain, either through yoga, MBSR, or some other modality?
I'm not sure if that's been looked at. I'm pretty sure that the mediators of how yoga works as a therapy have maybe been studied or reported in maybe one or two studies. Okay. And I think self-efficacy improves, so that's kind of how someone views their own ability to take care of their own health, their self-efficacy, improves over a period of time of practicing yoga. So that's somewhat similar, but I'm not sure if other things change. In theory they would, but I'm not that familiar with that body of research.
Okay.
Yeah.
Seems like their self-confidence goes up if they're doing yoga and they feel more able to take care of themselves.
Yeah.
I think feeling in control may decrease pain.
Right.
The sense of control.
Yeah, there are a lot of studies that use kind of a behavioral component that gets at the same thing and combines that with exercise therapy or manual therapy, and the results improve. People have better outcomes.
Can you say as a blanket statement that improving your abdominal core will help with back pain? Are they related?
Maybe for some people, and that's the tough thing about making general statements. And for example, exercise therapy and spinal manipulation are two of the most studied therapies for low back pain. There are literally hundreds of studies, and if you kind of pull them all together, you do a systematic review of that, you'll find that back pain or spinal manipulation is somewhat better than usual care, better than no care, and maybe as good or better than some common therapies. And that doesn't sound that impressive, but this is across lots of people, lots of participants, and the reality is that it's very individualized, and some people are going to do incredibly well with spinal manipulation in a short period of time. Some people are going to have a good or favorable outcome over a longer period of time, and some patients won't respond that well to spinal manipulation. The same is true of exercise therapy and a number of other things. So it's hard to generalize, but it's generally better than no care, and generally better than kind of the usual care that you would receive of advice and some sort of medication.
And are there specific exercises that make a difference for people with back pain? I mean, I'm assuming it depends on whether it's upper or lower, but say it's lower, because I think that I'm assuming that that's pretty common.
Yeah, so I use a lot of yoga poses actually. So for people who have kind of disc-related pain, some sort of mild back bend is usually tolerated and helpful, something like a sphinx or a cobra maybe.
So you're not going on your back, you're actually lying on the floor and pushing up.
Maybe not all the way up, but kind of like this on your elbows. Just a mild back bend can be helpful. And there's a exercise therapy activity called the prone press up, which looks the same. It looks like the same kind of thing. For people who have a stiff back or maybe strained a muscle in their back, I'll often give them child's pose and cat-cow. It's kind of a nice limbering exercise for the low back. And people who have maybe stenosis, there are specific exercises for stenosis.
What about posture and computer use? Because I'm assuming, maybe I'm wrong, but I'm assuming that as human beings are on the computer more, particularly laptops, that we're like this, and that it's making your business better, but not necessarily our lives.
I definitely think so. One, because when you're at a desk job, you're sedentary.
Right.
You're not moving as much as you would if you were kind of walking around or even standing. And two, when you're sitting, you'll notice that my hips are flexed. So the muscles on the front side of my hip are going to be in a short position. And if you spend a lot of time sitting, those muscles will shorten up and tighten up over time. And that might not immediately cause pain, but it may cause an imbalance that over time will cause pain. And maybe when you go to pick up that paper clip, you'll start an episode, but it might not have a whole lot to do with the paper clip.
The paper clip is the straw, right?
The straw, that's right.
So sounds like if these muscles are tight, those would be things like lunges and quadricep stretches, and like, is that the kind of stretch that makes a difference?
The quad is a hip flexor, but often in this position, the more important muscle is the psoas, which is a deeper muscle. It crosses the hip and the pelvis and the lumbar spine. So it's a deeper muscle, and it's a very large muscle. So something like a runner's lunge or warrior one, which is a yoga pose, can get at that muscle, but sometimes even that, it's tricky to differentiate the psoas from the quad when you're doing that stretch, because if your quad's tight, you might stretch that out, and you might need to modify how you're holding your hips and your pelvis to get at the psoas. And for posture, the same is true of kind of the upper back and neck. Often our heads start to come forward and our shoulders roll forward, and that means that there's a lot of tension in the front part of the shoulder where those muscles are shortening and constricting and potentially becoming tighter over time.
I think tennis balls in a sock are like my best friend.
It's great.
You know, just to go down the spine with.
So that's another whole area of self-care. Self-myofascial work, using a golf ball for the foot or a tennis ball for the hip or the back, or using a foam roller for the large muscles of the back or the quads or other large muscles of the arms or legs. Incredibly valuable, and it's different than stretching. Stretching can help with overall range of motion and can be really helpful for your musculoskeletal health, but kind of foam rolling and other types of myofascial release at home can really improve the quality of the muscles. If you have thickened muscles, it'll help kind of maybe break some of the adhesions up or the tension up. It'll bring fresh blood to the tissue like stretching may not. So I certainly recommend foam rolling or something like foam rolling for almost all of my patients.
Sarah, I've always wondered, because I do this at home, and after 10 seconds, I'm like, that's great. How long do you do the foam roller on, say I was doing it on my quads or on the hip or back, how long do you do it for?
So if you're listening at home and you've never done this before, you want to start off slow, right? If you've never done it before, it can be quite tender, especially if you're working on a tighter, tender area. So just going for kind of scanning the area for 30 seconds to a minute initially is going to get you a feel for how to use a foam roller. Sometimes it can be a little awkward.
It's definitely awkward.
Yeah, it can be really awkward for everyone, including myself, and I've done it for a while now. But once you get used to it, you're kind of scanning the quad, the hamstring, these large muscles, and you're going to find a spot that feels tight. And you might want to shy away from that spot. But I would encourage you to work on that spot and maybe spend 20 to 30 seconds kind of rolling, doing small rolls over the spot that feels the tightest.
And so if it feels excruciating, you'd recommend back off?
I would.
Okay.
Yeah, 0's no pain and 10's the worst pain. It's fine to be operating at a 4 to 5. You're not doing any harm, even though you're feeling that tenderness. But if you're at a 9 or a 10, if it's really hurting, you're doing too much.
Okay.
So mild to moderate intensity.
So there's no points for harming yourself?
There's no points for pushing it to the max when it comes to foam rolling.
Okay. Can you harm yourself?
It's not something that I don't get feedback from patients that they're harming themselves when they do it. I get feedback from patients who say, I tried it and it hurt and I never want to do it again. But if they stick with it and kind of ease into it, for most people it ends up being pretty helpful.
What about a rolling pin for people who aren't able to get themselves down on the floor in that fashion? Can they use a rolling pin on their quads to loosen them?
Yeah, there's actually a invention called the stick, which is pretty much a rolling pin. And a lot of endurance athletes, runners, cyclists use that. They purchase that, but it looks kind of like a rolling pin. So if that's all you have at home and you want to give it a shot, just kind of rolling through the quads is probably an easy way to get a feel for that.
Okay. And then if you're lying on tennis balls on the back, how long do you lie on those for? You know, and I'm assuming you lie on tennis balls, move them down the spine, not on the spine, but along the spine. Is that correct?
So you can do a number of things. You can always, whether it's a tennis ball or a foam roller, you can kind of roll on the area. That's going to help get blood flow to the area. But when you find a tight spot, you want to kind of get the foam roller or the tennis ball right on that spot and kind of hold it for 10 seconds and then kind of take a break and maybe come back to it or do it again the next day.
Is it recommended when you're just starting out to do those every day, or is it recommended to do it every other day or every third day? I mean, is it like exercise where you want to give the muscles a chance to recover?
If you're doing stretching or myofascial work at kind of a mild to moderate intensity, I think you can do it a little bit each day.
Okay.
Yep.
And is there anything people shouldn't do with the tennis ball or foam roller?
Sometimes it can be uncomfortable and very difficult to use, like a foam roller or even a tennis ball on the neck. So I would discourage people to use that on the neck. There is another invention called the Theracane, which is kind of looks like a cane or a candy cane. You kind of hook it over and you can get at the tight spots on the back of the neck. So, you know, different parts of your body are shaped in different ways. And you might need a few different tools to get at them for this type of self-care.
Are these things you can buy online?
All of them.
Okay.
All of them. A lot of them you can get at, like a foam roller you can get at pretty much any sporting goods store. They're getting pretty popular.
Okay. Sounds like the stick and the cane?
The stick
The Theracane?
and the Theracane you could probably find at like a running store. Definitely the stick, you would be able to find some sort of version of that at a running store because they're, like I said, they're really popular with endurance athletes.
Okay.
The Theracane you might need to buy online.
Okay, and it's Thera, cane?
Yeah.
Okay. All right. Now, in terms of yoga, do you recommend people do at-home classes, you know, a DVD, or do they go to a class, or if they're doing any yoga, is that sufficient for back pain, or is there a yoga class for back pain?
Right, it's a good question. So there are about 15 randomized controlled trials, and all of them used a pretty controlled protocol focused on back pain. So they're doing postures that they think are generally helpful for the hips and low back, or are specifically helpful.
But would that be on a DVD that someone buys, like good for back pain, or is it kind of like a general type of yoga is good for back pain?
It could be. The point I wanted to make is that most yoga is probably fine, but there are some versions that are a little more intense than what has been studied.
Yeah.
So it might not be the best thing. A really hot yoga class or a really intense Ashtanga class might not be the best fit for someone who's never done yoga before. So some sort of basic yoga class or some sort of back-focused yoga class is good. And I think at the end of the day, it's really about the attitude and the experience of the instructor. If you find someone who's really good, who you can kind of confide in and say, you know, my back has been a problem now or in the past, they should be able to help you to do modifications so that you can really succeed with yoga.
Okay. Does spinning ever help for back pain?
Any general exercise is probably protective for back pain. One thing that I do come across with cyclists or people who spin is that you're spending a lot of time with your hips fully flexed. You're kind of working through a small range of motion, which is primarily into the range of flexion, and you're rarely extending your hips. So I think it's good, but you want to start before you start cycling, and probably after you're cycling, you want to really stretch the hips. And again, we were talking about kind of a runner's lunge or warrior one position, really being mindful of what the hips are doing and trying to keep them as limber as possible, because if the hips are tight, that tension is going to make the more of what you're doing rely on the flexibility of the low back. So more of the pressure may fall on the low back, and that might be irritating for some people.
And then you probably overcompensate by tensing up your upper back.
Right, right. So the mid back is a common area that most people would benefit from foam rolling because it's generally tight, the hips are generally tight, and the low back often has too much movement. That's why core stability is helpful for a lot of people.
Okay, so that's Pilates or another core exercise.
I think Pilates is a great activity for a lot of people, and you know, yoga and sometimes Pilates, I think they can be community based, which might be encouraging and helpful for some people, or some people might prefer kind of the one-on-one, and I think you can do both with either yoga or Pilates, which is nice.
Okay. So it sounds like, as we're sort of coming to the end of our time in this show, it sounds like there's a whole range of things that people could do for back pain. And if you could just spend like 1 minute summing up, like, here's the options, and
sure,
that'd be great.
Yeah, so if you have back pain, what you should do is see someone who has a really good understanding of how to diagnose back pain. That could be a primary care provider. It could also be a chiropractor or a doctor of physical therapy, someone who's going to do a number of orthopedic tests, who's going to look at your range of motion, your function, and kind of take get a good picture of your overall musculoskeletal health and function. And one of those types of providers can give you an accurate diagnosis, which may or may not influence what treatment's going to be best for you. If your joint is irritated and you can kind of confirm that on an orthopedic test, some sort of joint mobilization or manipulation might be the best thing for you. If the provider presses into a soft tissue, a muscle or a tendon, and they can recreate your pain by pressing into that structure or stretching that structure or getting that structure to contract, might be able to narrow it down and differentiate that type of back pain from a type of pain that primarily relates to the joint. So seeing someone who's going to give you a diagnosis first is probably the most important thing that you can do. And then from there might be multiple options that will be effective for you, or there might just be a couple that will be make the most sense.
So it sounds like the most important thing is to see a qualified professional and then get into some type of treatment program in partnership with them.
I think that is absolutely the most important thing initially, and then also trying to find a provider who's going to recommend a lot of self-care strategies for you beyond the pain episode. Because for most people, their pain gets much better, and there are many things they can do to maintain their musculoskeletal health.
So they should have hope.
Oh, of course, of course.
Awesome. Thank you for joining us.
Thanks for having me, Wendie.
We've come to the end of our show. Thank you for joining us for another episode of Visions for Health. I'm Wendie Trubow, and my guest today is Eric Roseen, Doctor of Chiropractic.